A lot of people think that hydromorphone is a watered version of morphine, like a kind of diluted morphine. Well, it's not. Actually, hydromorphone is much more powerful than morphine. Today, I will answer some questions that people ask me about hydromorphone. What is hydromorphone? Is it effective for pain relief? Why my doctor only prescribed me a small dose of hydromorphone? Can it cause physical dependence and addiction? Does it have a risk of overdose? How do I know if it is working for my pain? What are the potential side effects? Can I take alcohol with hydromorphone? So let's talk about hydromorphone today. According to the DEA, the United States Drug Enforcement Administration, in 2022, there were 2.16 million prescriptions dispensed for hydromorphone in the United States. That's a lot of prescriptions. So, what is hydromorphone? Hydromorphone is a potent painkiller. It is a semi-synthetic opioid agonist derived from morphine. The effects on opioid receptors, the indications, contraindications, dependence, abuse, and toxic effects are the same as other opioids like morphine or oxycodone. However, hydromorphone is much more powerful than morphine. So the person would need a lower dose of hydromorphone to achieve the same effects that they would have with morphine or oxycodone. For example, 2 milligrams of hydromorphone gives the same effect as 10 milligrams of morphine or 10 milligrams of hydrocodone and equivalent to 7 milligrams of oxycodone. I prepared a summary for you that contains all the information in this video. Go to the description of this video below. There is a link for you to download this free summary. Is hydromorphone effective for pain relief? Before I continue, let me remind you that this video is not medical advice. The intent is for educational purposes only. If you have a condition that requires opioids, please talk to your doctor or ask a pharmacist. If there is an emergency, please call an ambulance or go to the nearest emergency department. Like any other opioid, hydromorphone produces analgesia within 15 minutes of taking an injection and about 30 minutes following an oral tablet or suspension. The pain-relieving effects last approximately 5 hours, unless the tablet is specially modified to release it slowly, and this may last up to 12 or even 24 hours. But these tablets are specifically prepared in laboratory. They're more expensive. They're called extended release tablets or controlled release tablets. Hydromorphone, like any other opioid, is most effective for pain that is acute, nociceptive, after a trauma or an injury. Their effects on chronic neuropathic or nociplastic pain are less noticeable. If you want to learn more about the 3 types of pain, check my other video here. Why my doctor only prescribed a small dose of hydromorphone? I had a patient one day who was angry at her doctor for not prescribing a high enough dose of hydromorphone for her. She thought the doctors didn't know how to prescribe hydromorphone and they were afraid of giving her the full dose. I explained this to her and she understood that she was actually getting the right dose for her. We prescribe lower doses of hydromorphone because it is much more potent than the other opioids. So 2 milligrams of hydromorphone is equivalent to 10 milligrams of morphine and 10 milligrams of hydrocodone. Can it cause physical dependence and addiction? Hydromorphone has the same risks of physical dependence and opioid use disorders as any other opioid. Any patient who is starting on hydromorphone should be assessed for risks of opioid use disorder and risks of misuse. When the prescription is for acute pain, it should be shorter than 10 days. If the person has chronic pain, a long-term plan needs to be discussed with the prescriber and it should involve the pharmacist. A trial of opioid of about 2 to 6 weeks or 2 to 3 dose increases is the best initial step. If the opioid trial does not show any clear or meaningful gain in function, it is advisable to taper and stop the hydromorphone. The longer the person takes an opioid, the harder it is to stop it. If there is evidence of harms, misuse, or addiction, the opioid should be tapered slowly and the person may need to consult with an addiction medicine practitioner, either to switch to another opioid or to stop under a controlled environment. Does hydromorphone have a risk of overdose? Yes, hydromorphone is an opioid, so it carries the same risks of overdose as any other opioid. Because hydromorphone is a powerful opioid, an overdose may happen at a low dose. Someone who has never taken an opioid may overdose on a much lower dose than someone who is physically dependent on opioids and is taking it at a higher dose. The first symptoms of an opioid overdose include sedation. It's hard for the person to remain awake. Then they breathe slowly. They may have episodes that they stop breathing for a few seconds. Then they become very cold, unable to move, the pupils become very small, their blood pressure drops, and the heart rate is very slow. Anyone taking opioids should carry a naloxone kit. This is an antidote to opioids and can save their lives. A family member, a friend, a coworker should be aware that the person takes opioids and then carry a naloxone kit, so they could administer in case the person overdoses. The patients themselves will not be able to administer, as they will be in coma. The best way to avoid an overdose is only take the dose that is prescribed and do not take more or at higher frequencies. In addition, they should not take it with alcohol, a benzodiazepine, or gabapentin. How do I know if hydromorphone is working for my pain? Well, if hydromorphone works for your pain, then you should be able to function like a normal person. You should be able to take care of yourself and others who need you, go to school or work, or do the hobbies that you enjoy. When opioids work for pain, they usually do not need to be given in super high doses. That is because higher doses may cause other problems. If you're enjoying this video so far, don't forget to subscribe to this channel and turn on the notifications. What are the potential side effects? Hydromorphone, like any other opioid, can cause euphoria, relaxation, and reduce anxiety. It may also cause mental clouding, changes in mood, nervousness, restlessness. Other side effects include constipation, nausea, vomiting, itching, dry mouth, headaches, and low sex drive. In people who take high dose of opioids, and in the case of hydromorphone, we're talking about a total daily dose of about 20 milligrams per day if taken by mouth. Then the opioid will start causing damage to other organs of the body, and it can cause sleep apnea, impotence, suppress the immune system, and weaken the bones, which is known as osteoporosis. Can I take alcohol with hydromorphone? Both opioids and alcohol diminish the brain activities. They're called central nervous system depressants. They inhibit the synapses and electrical activities in our brains. Therefore, the person has difficulty to think, to make decisions, to be alert, to judge situations, and is more sleepy. Combining both is dangerous because they act together in the neurons and can lead to a coma much quicker than when taken separately. So no, it's not a good idea to mix opioids with alcohol. Also, benzodiazepines, which are sleeping pills, should not be mixed with opioids, for the same reasons that I explained above for alcohol and opioids. If you have hydromorphone at home and are not using it anymore, please return it to your pharmacist or dispose it safely. Keeping these medications at home is very dangerous. Answer this question in the comments below. What is your experience with hydromorphone? Write a comment that will help other people make an informed decision about taking or not this powerful opioid. Thank you for watching today. Goodbye.